Attention deficit hyperactivity disorder is one of the most commonly diagnosed disorders in young children, with as many as 1 in 10 children receiving a diagnosis of ADHD between the ages of 5 and 17, and boys being twice as likely to receive a diagnosis compared to girls. Despite its prevalence, we are unsure of the exact causes of ADHD, although it's thought to be a neurological disorder and involve genetics. Children with ADHD can have a hard time staying on task. They may be forgetful or distracted, have a hard time sitting still, or maybe daydream a lot. Girls with ADHD may present as hyper-talkative rather than hyperactive. ADHD can create difficulties in the classroom. And when left undiagnosed, children with ADHD can be unfairly judged as being naughty or distracting to others, which can negatively impact their self-esteem. In addition to that, when we're unable to stay on task, it creates a barrier to learning. One of the ways that I try to lessen this barrier to learning is with the Forbrain. Forbrain is a wireless altered auditory feedback device that has a microphone, a dynamic speech filter, and the use of bone conduction to stimulate the auditory nerve directly. So when we wear it, we can hear ourselves in real time, but just slightly louder. For some children with ADHD, this effect of being able to hear themselves slightly louder has a kind of grounding effect, and it helps them to stay focused, present, and on task. It can also help them to remember things better, because when we hear ourselves slightly louder, it makes the message easier for the brain to process. When I introduce Forbrain to a child with ADHD, I first like to show them how I wear it, and then I let them have a turn. I found that children with ADHD tend to really enjoy wearing the Forbrain and are generally not too sensitive about the volume, so we can have the volume at normal levels even when we're just introducing the Forbrain. When I use Forbrain in a session for a child with ADHD, I aim to keep it on for about 10 minutes per session, and I like to use it in parts of the session where I need the child to really focus. Maybe something like when I'm giving a multiple step instruction, I could have the child wear the Forbrain and have the microphone turned towards my voice so that they can hear my voice slightly louder. Or I can have the child wear the Forbrain with the microphone turned towards themselves and have them repeat back the instruction so that they can hear their own voice slightly louder. It can also be a good tool to use in activities where children might generally have a hard time staying focused, maybe like reading books together where they might daydream. Some of the parents that I work with like to invest in a Forbrain to use outside of therapy sessions. And one of my favorite ways to carry over the work that we've been doing into real life is to have the child wear their Forbrain in school. Because it's a wireless headset, it's very easy to use in a classroom setting for just 10 minutes here or there throughout the day to help the child get through the parts of the day that may be challenging for their attention. Maybe things like circle time where they have to sit and wait, or like table time where they have to follow instructions from the teacher and work independently. It does, of course, take collaboration with the teacher, but it is totally worth it. Forbrain has been an excellent addition to my therapist toolkit, and I especially enjoy using it when I work with children with ADHD.